Welcome to the Next Step in Care learning series. This video is designed to provide healthcare and social service providers with ideas and guidance on ways to work together with family caregivers.
Generally speaking, you're going to want to interview the patient and caregiver together. When you've seen one Alzheimer's patient, you've seen one Alzheimer's patient. I mean, there's some early stage patients for whom having someone else in the room may be completely inappropriate. There's some late stage patients who are nonverbal. So exactly who you're going to be interviewing depends on the situation. Generally, if there's a caregiver who's involved with this person, they will not object to their being there. It doesn't hurt to ask. I'd like to have your wife here at the same time so she can hear everything the same as I am, and as I'm hearing it. And generally speaking, patients will be highly supportive of that. And we tend to think of family caregiver as though this was a biological relationship, but very frequently the person who's bringing the individual in and who really knows the situation very well is actually the home health aide who works with them every day, and not the nephew who lives in California and arranges their finances over the telephone. So family is not what's really we're talking about here, but in fact household contact kind of information is the person that you want there with you under most circumstances. I always like to have at least a minute or two alone with the patient, partly because it recognizes them as an individual. Sometimes they do have things they want to tell you that they don't want other people to hear, or things that they're worried about that they're a little embarrassed to say in front of somebody else. And so it's nice to have a little bit of time separately. And sometimes the caregivers have things that they very much want to tell you that they may not want to have to say in front of the patient. So it's ideal to have a moment or two together with each one of them under the best of circumstances. And because these are going to be longer interviews and often somewhat repetitive, and as I'm saying, interrupted by repetition of the things of the explanation of why things are going on, it's important to cover the important things early because hopefully you can fill in the rest of the information on some later interview. I mean, I know we're all dealing with, history and physical forms on admission and OASIS forms to be dealt with home care and the rest of that. And there's this information you just desperately have to have and so on. But sometimes the end of the interview is, I was told by the hospital you don't smoke, don't drink, live with your wife, have 2 children. We're born in California and are a retired steelworker. Is that all correct? Then you can fill in all the rest of that information on the form if you need to, because often patients get driven crazy by having to give you the same information that you were supposed to have gotten already 11 times from all the other different referral sources, but which you're now repeating in your setting. And again, some physical examination suggestions. We tend to tell patients, take off all your clothing, put on this gown, and with the opening towards the back. That instruction already is a multi-step task for most patients and not too likely to be followed. But on top of that, we always tell people to do that because that's convenient for us. Then we can go do something else while they're putting on the gown with their rear end hanging out. But when you think about the context of an interaction from the point of view of a dementia patient, their task at the end of all of this is to, if they're coming to see you in the office setting, their task is to get back home again. If they're seeing you in the home, their contact is to be able to get dressed again and have this be done with. Okay? So when you take away all of people's clothing, okay, you put them in what's a potentially frightening situation. Now there's some patients who are perfectly fine with this. Clearly the people who go running out into the night naked are not worried about where their clothing is, but for a very large number of patients, they really do worry at the time of the examination, will they be able to find their shoes to be able to go back home again? And this is not such a funny thing to think about because losing shoes is not an unusual event in their life. Okay, having difficulty finding the key things that you need is part of their day-to-day existence. So I strongly recommend that you only undress, both for comfort and privacy reasons, but also for the comfort of the patient, that you undress the portion of the anatomy that you're examining at that time. And if the patient wants to, let them hold their shoes while you examine their feet. Let them hold their shirt while you listen to their lungs. because you don't have anything to do with it. It's not better for you that it's hanging on a hook. But it can be very comforting for them to be aware that they're not going to lose these key things, which they have unfortunately perhaps lost all too many times in their past existence. And of course, watching the patient dressing and undressing can give you some quite significant functional information about how the patient actually is able to do things. I mean, getting dressed is a pretty complicated task, at least for some of us in the morning. But the patients, are probably going to have to, should be dressed and undressed by whoever would normally do that in their home situation. And there's no reason, to embarrass someone who can't get dressed by themselves by asking them to dress themselves if that's not something that they would normally be able to do. When you're doing the examination, we take it for granted that patients understand what the next thing we're doing is. When you take out a stethoscope, that cold metal is going to be put to their chest so you can listen to their heart and lungs and so on. But dementia patients frequently are not familiar with what your examination is going to consist of, or what you're going to do next. And all the time that you're doing these things, it is much more effective if you talk the patient through what you're doing. And now I'd like you to open your mouth. I'm going to put in a tongue depressor. I'm going to be looking at the back of your throat. I'm going to shine a flashlight in. I mean, all these things that we pretty much take for granted. I'm going to feel your neck now. I'm looking for swollen glands. I'm going to feel your thyroid gland here in the front. I'm going to touch the bottoms of your feet. This might tickle a little bit. I mean, you just continue to walk people through this while you're doing it. Sometimes for healthcare professionals, this sounds a little bit silly. We're kind of talking out, the things that we're going to do. I'm going to lift up the back of your shirt so I can, I'm going to want you to take a deep breath so I can hear how your breath sounds, so how your lungs are working. Just keep saying, but it orients the patient to what it is you're doing. There should be no surprises during physical examination. They should know what you're about to do before you do it. Even if it means, I'm going to stick a finger in and feel your prostate gland. This may be a little bit uncomfortable. Warn people in advance of everything you're going to do, and you're going to have a much more cooperative patient who's able to participate in the exam with you. Because as I said, the patients want to be sociable, they want to participate, they want to be cooperative, but we're doing a whole lot of frightening things to them. We're sticking fingers where fingers don't belong, sticking them with sharp implements, we're putting them in cold environments with no clothing. I mean, strange people are stripping their clothes off. These are things you're supposed to fight against. I mean, when someone you don't know, wants to take off your underwear, there are socially appropriate responses unless you understand what is going on. So it's important to explain to people exactly what you're doing and why you're doing it. I need to see that rash on your buttocks that your wife was telling you about, so on and so on. Makes it a much more functional, a much more comfortable examination, and a much more successful examination for you, because after you've been hit a couple of times by patients, you begin to understand that the natural reaction to people assaulting you is to fight back. And we're not assaulting the patient. At least we shouldn't be assaulting the patient. We're trying to collaborate with that patient in their own care. But we can only do that if they understand what we're doing.